started, we have a lot of good information to share with you. And I want to make sure that you have time to listen to all the great information that we're going to be sharing. Our topic today, and this is a very exciting series that we have going, focused primarily on COVID-19 and getting information to you, and so that you can also help spread that information. Is this one's focused on apps for promoting independence and safety. And we're very excited because there are so many apps that are out there. A lot of y'all have requested this topic in particular. A great idea. And I'm happy to say that we've got some solutions that we'll be absolutely sharing with you. We'll move to the next slide. And I have the great pleasure of introducing you and welcoming Danny Housley, who has presented on this and so many other topics when it comes to looking at safety, looking at independence, and all of that, and specifically around COVID-19. He is an awesome member of our team, along with Sierra Montez, and I'm going to have them introduce themselves. I'm just going to give another shout out to Sierra because she actually is the person who has taken our app finder that Martha created in 2007 and has grown it exponentially. And a lot of y'all, I was looking at the names, a lot of you have actually provided apps for us. And so please know that we're open to that. This is really about collective brilliance. And so send those our way. So Danny, will you introduce yourself?
Sure. Good afternoon. I'm Danny Housley. I'm the AT Acquisition Manager with Tools for Life. So I work with individuals to help find funding solutions and options to increase their independence. And I am a very active advocate outside of work.
Excellent. Thank you, Danny. Sierra.
Hi, everyone. My name is Sierra Montez. I am the AT support specialist with Tools for Life. I am on the direct service team, so I work a lot one-on-one with clients, providing loans, demonstrations, and evaluations.
And you do such a great job with all of that. That's great. So, and I'm Carolyn Phillips. I am the director of Tools for Life and also the director of services and education here at the Center for Inclusive Design and Innovation within the College of Design at Georgia Tech. And we also have Cassandra, who's going to be helping us when it comes to American Sign Language as our interpreter. So thank you, thank you. And then we also have Loria with us, who is helping and providing awesome captioning. We believe in nothing about us without us. And we also believe in making our educational opportunities as accessible as possible. And so just wanted to point those pieces out as we move forward, and feel free to ask us questions as we move forward. We have an awesome team who actually have created this whole series. And so thank you to Sam Peters and Tori Hughes. And then also I'm going to turn it right on over to Liz Prasad, who's going to give you some tips for today's session. So Liz, take it away.
Thank you, Carolyn. Hi, everyone. My name is Liz Prasad. I serve as the Program and Outreach Manager for Tools for Life within CIDI here at Georgia Tech, and I'm also one of the co-PIs for this project, bringing the series to you today. Just a couple of quick tips for today's session. Wanted to let everyone know that we are actively recording today's webinar. This webinar recording, transcript, as well as the accessible PowerPoint presentation will be made available to anyone that needs to view the recording. It will also have this posted online, and we'll be sharing that in the upcoming days. As Carolyn mentioned, we practice what we teach, and captions are available within Zoom by selecting Show Subtitles, or you can click on this link for a full view of the captions. I believe Lorea, our captioner, put this information in the chat window, so feel free to check that out and click on the link if you need to show stream text for captioning. I wanted to remind folks that if you are not actively speaking, please mute your microphone. We do have the ability to mute everyone, but we just ask that you pay attention to that, so that way folks can hear our presenters and all of the awesome information that they have to share today. Please do utilize that chat window to ask questions or post comments throughout today's presentation. We'll be keeping an eye on it and we'll be reading all of your questions and comments out loud so we can be sure to capture that in the recording. There is an opportunity for you to use your microphone and to also use the raise your hand feature. We'll be doing that during the Q&A portion at the end of today's presentation. So just know that you will have an opportunity to interact with Sierra, Danny, and Carolyn. Also wanted to let folks know that continuing education credits are available for this webinar and any webinar that we offer moving forward in this series. So this webinar is eligible for CEUs, which are approved and distributed by the AAC Institute. We are also approved for offering CRCs, and these are approved and distributed by the Commission on Counselor Rehabilitation Certification, or CRCC for short, as many of you know them by. If you are interested in receiving CEUs and or CRCs, please send an email to this email address here, and I'll get one of my co-hosts to type this in the chat as well too. But the email address is training@gatech.gatech.edu. So training@gatfl.gatech.edu. Eligible participants will typically receive their credits within 2 to 6 weeks after the live webinar. So just reach out if you have any questions moving forward. So with that, I will turn the microphone back over to Carolyn.
All right. Thank you so much, Liz. And so a big thank you to our sponsor, the CDC Foundation. We are absolutely enjoying our relationship and building upon that relationship and creating this. And this webinar series wouldn't be possible without the CDC Foundation. So this webinar series is made possible due to funding from the CDC Foundation, along with technical assistance from the Centers for Disease Control and Prevention. So just wanted to make sure you knew that, the good work that's happening over there. Our session description, life does look a lot different for folks as we collectively navigate through this COVID-19 crisis. We are continuing to do this. And so we wanted to be timely and get this information out to you when it comes to staying safe and healthy and physically distanced. It's more important now than ever. And there are a lot of apps and extensions and accessibility features that I think a lot of people don't even realize are in their pockets or on their computer that are built into different platforms, and they can really help you and other folks that you care about stay safe. So we're thrilled that you've joined us today to come and learn and share as we share information. We would love to hear from you. As I said, if you have apps that are working for you when it comes to connecting with others, decreasing social isolation, increasing, shopping in a touch-free environment, ways that we can navigate and even relax. It's so important. So thrilled that you're here, and we do have some learning objectives. And those learning objectives are really focused on making sure that you have knowledge so you can compare and contrast, at least 3 apps for physically distancing, for touchless shopping. Also, be able to access the accessibility features when it comes to understanding how they can help with organization, which can also decrease stress and increase health on multiple levels during this COVID-19 crisis. And also be able to discuss at least 2 apps that can assist with mindfulness and relaxation, and be able to successfully navigate the App Finder, our Tools for Life App Finder that Sierra has spent so much time and energy developing. We are here at the Center for Inclusive Design and Innovation. We do all kinds of great work when it comes to looking at practical solutions for accessibility, inclusion, really focusing on utility, ease of use, high quality products, training. There's a whole cycle of research that informs education, that informs practice, that informs policy, and that's the great space that we get to work in. That includes our Braille services, our captioning services, our professional e-text producers, and of course, our certified assistive technology team, which you're going to hear from 2 of these awesome folks in just a moment. This is the Assistive Technology Act program, Tools for Life. A lot of the members of our team you have just heard from. And Tools for Life is a part of a network of Assistive Technology Act programs. They are funded through HHS and ACL. And our project is really mission focused, and it's very tied to the law. So focused on making sure that we can increase access to and acquisition of assistive technology, devices, and services for Georgians of all ages and disabilities, so everyone can live, learn, work, and play independently with greater freedom in communities of their choice. And that's really what it's about for us. So there's an image here of my colleagues with Tools for Life, Tori, Danny, and Liz doing another presentation. And I just love the energy of that. And this is actually in my office at Georgia Tech. So, all right, and we'll move to the next slide. And I'm going to turn this on over to Danny. Danny, take it away.
Yes. When we get into this, we really want to make sure that everybody has a good foundation. And we want to start by covering what the definition of assistive technology is. And this is part of the definition as it comes directly from the AT Act. And so assistive technology is any item, piece of equipment, or product system, whether acquired commercially off the shelf, modified, or customized, that is used to increase, maintain, or improve functional capabilities of a person with a disability. That is a lot to unpack. But what it boils down to is that assistive technology is anything that increases the independence of an individual with a disability. And that could be something that's specifically designed for that individual or for something related to their disability, or it could be something that's improvised. And that definition is intentionally broad so that nothing is disqualified. You don't have to worry about something not counting as assistive technology. It really allows the individual to decide what is going to work best for them to increase their independence. So with this definition, it often leads us into the question of what assistive technology is the right assistive technology, because there is so much room in that definition. And it all boils down to it depends. We have an image here of a mug, coffee mug with the words, it depends. This is not always the definition that somebody wants or the answer that somebody wants. Oftentimes people want a clear-cut solution, but everybody is different. I have a visual disability, and what works well for me may not work well for somebody who may have my same, and I'm going to put air quotes in this, diagnosis. So you really have to rely on making a connection, finding out from the individual what it is, or letting the person choose what's going to work well for them, rather than taking a prescriptivist approach. So here, we always like to talk about beginning with the end in mind, working towards a goal. That is very important, especially when you're looking at finding a technology solution. You want to really dig down and develop, what are the barriers that you're facing and what are the tools that we can find to help break that barrier down. And there is an individual here who's getting ready to walk across a bridge made of puzzle pieces, and they're holding that missing piece. They're moving towards their goal. So when we talk about being prepared, especially when it comes to AT for a disaster, we talk about those blue sky days and beyond. So the blue sky days are where everything is great. When there's not a storm or a pandemic or something going on. And then you want to make sure that you're getting ready for when something does happen. So we want to be prepared before something happens. So it's important to do things like checking your assistive technology and your supplies regularly. Maybe you don't always use that power chair, but you want to make sure that it's charged but not overcharged, making sure the battery's in good condition, having a plan and a contact strategy. So if something goes awry, if you have to maybe evacuate or if something is happening, that you do have a plan in place for contacting the people that are important in your life. Exploring your options ahead of time. So not waiting until something hits before you actually know what your assistive technology options are. Knowing, your high-tech solutions that you may own already, and then what are some of those medium and low-tech solutions that can help with maintaining your independence in the case of an emergency. Knowing what your local support agencies and emergency services, being in contact with them, knowing their numbers, knowing who you can reach out to, and then keeping important documents safe and ready to grab. This, we look at this primarily for things like, if there's a natural disaster and you have to evacuate, you really want to be able to make sure that you have access to things like your, birth certificate, social security card, insurance documents, that those are ready to go. Now, when we look at specifically for assistive technology considerations, one of the biggest ones is power. A lot of those medium and high-tech solutions do rely on electricity or batteries. So you really want to make sure that you have battery packs, if it's for your home, a safely located generator, making sure that your items are charged from the get-go so that you're not already starting off at 20% battery. Looking to see if there are low-tech solutions as a backup. What's something you can keep in a bag, or something that you can tell somebody to use to take the place of maybe a medium or high-tech solution. And then having a laminated inventory or schedules of medications and equipment. So this is good for insurance purposes. It's also good for making sure if you have a medication schedule you have to adhere to, that you have that and it's clear and you can clearly state to someone what the medication schedule that you're on is. And there is an image here of a battery pack, just a portable battery pack for maybe a mobile device. So we are going to delve into some of those apps for safety and independence. There's a lot of stuff. We're going to be covering a lot of information in a relatively short amount of time. So I'm going to turn it over to Sierra here to talk about our App Finder database.
Thank you, Danny. So Tools for Life has an App Finder database that has recently been updated. We have about 400 apps in it so far. You can search by the price, the category, the operating system, and it also now includes Chrome extensions. To the right, we have a picture of what our App Finder looks like on our website, and we also have the link to our website below. It's www.gatfl.gatech.edu. The App Finder database is really awesome, and we are constantly updating it. So if you ever have any apps that you would recommend to us, please give us those recommendations.
All right, so the first app we want to talk about here, this is one that we use at Georgia Tech. This is called Novid, and there is an image here of a mobile device showing the app with the logo there. So this is available for iOS and Android. So this is a pre-exposure notification and a contact tracing app. So it uses a mix of ultrasound, Bluetooth, and Wi-Fi to determine if you are in contact with somebody who may have tested positive for COVID-19. It is completely anonymous, so it uses sound waves and Bluetooth. So there's no personal identifying information that gets sent out with this. And it is up to the individuals to, go into the app and use it, and also to put in any positive test results that they may have gotten. Now it relies on a community to use it. So at Georgia Tech, we're using it because the students, the faculty, and the staff are all in relatively close contact at times. And so we want to make sure that you do have a heads up to notify about if someone had tested positive, and had you been in touch with them, and it'll even tell you how long you were in touch with them, which is, as we know, important. Next up, for current information, we do have the CDC app. So here you can go and find current information. There's a newsroom portion. You can get information on travel notices, outbreak information, scholarly articles, and just data for where things are currently standing with different outbreaks and items that they are tracking. And there's an image here of the CDC app. If you don't have this app, I do recommend it. It is very good, very informative. I do check it on a fairly regular basis just to kind of see what is going on. Another useful app is from the American Red Cross. This is their first aid app. And the image here to the right is their logo, their app logo. So with this, they do have a COVID-19 highlight portion. It focuses on preparedness. So like we were saying earlier, you want to be ready before something happens. So this is building up those skills, building up that knowledge. They have tips and advice for emergencies and preparing, what to pack, what to stock up on. You can find local hospitals. They also have quizzes to test your knowledge on things like basic first aid, on what to do in the event of various kinds of emergencies. So this is a free app. Again, very useful, really good for helping you plan and helping to expand your knowledge of that preparation. FEMA is another great app to keep track of. So with this, you can set alerts for up to 5 places. So this could be where you're living, where a family member is, or a loved one. Again, they have tips for preparedness and lists that you can access, so you can look at what are some of those different items, again, that you may want to supply that you may want to stock up on to have a supply of. Things like how much water you need per person for a household, how long to keep items for as well. You can also set your emergency meeting place. So if you have friends and family that are all connected with that, you can show where do you meet up if you have to evacuate, or if everybody's getting ready to go, where are we going to meet up? There are also tips for risk mitigation when it comes to responding to natural disasters, as well as a list of shelters. And the image here is of the FEMA app with some of those different areas highlighted. So getting tips, receiving alerts, locating shelters, and uploading and sharing your disaster photos. So it's a way of helping to document as well. Weather apps are very important when it comes to getting ready to prepare, to keep yourself informed. Here it says hyperlocal is best. What hyperlocal means is that it's really not just your county, but like more of your city, more of even maybe your neighborhood. Sometimes these rely on individuals to provide updates on weather conditions that are going on. And we do have 4 app icons to the right, and we're going to go over each one of those. So first is Weather Underground. Again, this is an app that relies on individuals to give real-time updates on, is it raining, is it hailing, what does it look like here, as well as drawing on things like NOAA and other satellite imagery for the storms. To the right, we also have the Dark Sky app, and this is one that is being integrated in a lot of different weather applications. So I know the Apple app uses that currently, as well as some of the other more popular ones. Hurricane Hound is specific to hurricanes. So if you are in an area that is prone to hurricanes, it can help you with tracking what the current status of the hurricane is, where it is, what the level is, and what the trajectory of that storm is. And then finally, if you want a little lighter bit of humor in your weather app, Carrot Weather is a fun app to use, and these are all free. You can download them. Dark Sky and Carrot Weather do have some in-app purchases, but the core functionality of live tracking the weather is free. And then don't forget your built-in apps on your smartphone. Every phone, Android, Apple, Windows Mobile, and BlackBerry, they all have built-in weather apps that do use satellite information to track where the storms are.
And Danny, I am so glad that you're going through all of those because I know we had a surge of, and it continues to surge, of request and need for, sheltering during this time of COVID, preparing during this time of COVID for all of these major storms. I'm so glad you're going over this. It's so good.
Yep. This is definitely one of those areas where sometimes people may not want to think about what's going to happen in the case of an emergency, but you'll be so glad that you did.
You're exactly right. And navigating it now, when we're also trying to practice social distancing, washing hands, the 3 Ws, wear a mask, you're exactly right.
And next up, we want to go over some options for communicating. And communicating is definitely a multi-way street. You want to look at sometimes communicating just means being able to get information. And that's where we start with optical character recognition. So for somebody with a print-related disability, someone who may not be able to access the printed word, either because of a visual disability or a learning disability, optical character recognition apps can literally be a lifesaver. So what this does, OCR, as it's often abbreviated to, it scans and reads text aloud. So you can take a picture of a sign, of a document that you're given, and it will read out all of the text that are on there. There are a lot of really good free options that you can get. It used to be one of the best options you could get was a paid app that was $100, but now we see a lot of innovation coming out when it comes to this kind of functionality. Some of the apps can even do handwriting. That used to be something that would be a really big barrier for individuals that, I work a lot in the blind community, and there were a lot of problems because you would be given something that was handwritten and your app couldn't use it, and then you were having to rely on somebody else to read it to you. So we do have 3 options that I put up here, and there are app icons to the right corresponding to those. So first we have Seeing AI. This came out a few years ago, and it is a very impressive app. Came out from Microsoft, and it was one of the, and it still is, the fastest OCR app that I've ever used. You can do spot reading with it. You can do longer documents. You can even do things like taking in a scene to kind of get an idea of what does the area you're in look like. I took a picture in an airplane, in a airport terminal, and it was able to tell me that there were people with suitcases and that it was crowded. So that's very useful. There's also a currency reader and a light indicator on it, and it can do handwriting. Very impressive app, and it is free. TapTapSee is another option. It can do optical character recognition, and it can also do object identification. So if you have a can, it can tell you if that can is fruit cocktail or if it's cat food. So very good app, and it's very quick. It does use some AI to identify those items as well as connect into the internet. And then finally, you have the KNFB Reader app. This is an app that the National Federation of the Blind came out with. It is $100, it's $99. You can often find it on sale right around the time school starts back. But it has a lot of the same functionality as Seeing AI. So you can do long or short text, so you can do multiple pages. You can also do some object identification and currency as well. All right, next up, we're going to turn it over to Sierra for the ICE medical standard.
Okay, so the ICE medical standard is basically an app that allows you to put your health information and emergency contact information on the lock screen of your cell phone. It's available on all Apple and Android devices. You have the option to order a physical card, and they also added an auto insurance feature. Should you be in an accident, you can put your information regarding your auto insurance on the app. It's really neat. You can see on the lock screen, they have different code colors. So if you're someone who's high risk, you could have the red color code. And then they also have the yellow color code, which is for medium risk, and then the green risk, or the green color code is for people who have no risks or low risk at all. Really neat app, super useful in the event that you may not be able to communicate that you have a certain disability or that something is going on.
Sierra, I was just going to say, I know you turned me on to this app, and I actually sent that out to several folks a while back. And I heard back just last night, somebody that ended up having to go to the hospital, their person that has communication issues, and it really did help. And so I meant to say thank you for that, but exactly how perfect the timing is for this.
Yeah, and a little later on, we're going to discuss another ICE kind of, or in case of emergency, bracelet that can be used for people who have communication troubles too.
All righty. Next up, we have the emergency chat app. And we do have the image to the right is just the icon of that app. So this is focused on people that are maybe experiencing sensory overload or a meltdown, as it is frequently referred to. So with this, what could happen oftentimes, sometimes people with autism or other intellectual disabilities, they may experience so much sensory input that their speech may shut down. They're still communicative, but they just can't verbalize anything. So with this, they can open up this app. It has a splash screen that explains the situation, that the person is just having too much input right now and they can't actually produce speech, and to please use this app to communicate. So it's a basic text app. It is customizable. You can change the font and the background and a lot of those different features, but this is something that can really help a person who is just overwhelmed, but they can still text to express themselves, again, to do things like finding their emergency contact, or finding family members, or even maintaining their medication schedule with a person. So again, a useful app, and it is free. All right, and this is Sierra to talk about some of the options for live captions.
So live captions give a means of communicating for someone with English proficiency. There's a couple of different applications and softwares that use live captioning. I do want to say that live captioning is usually AI, so it's usually computer generated. It's not like how we have a captioner on this presentation doing or actually writing and doing the captioning. So some options for that are Google Live Transcribe, which I believe is only available on Android devices. The Ava app, it's a really cool app. In the event that you're in a group setting, everyone can have the Ava app opened, and the person who is hard of hearing, they can actually see what everyone is saying with a full transcription. I do want to say that it is not 100% accurate. Sometimes it does not pick up inflections or punctuation. So that can be a little bit difficult, but it is a good, quick solution for people who are hard of hearing or deaf. Another software that has live captioning is Microsoft Teams. And I believe Zoom sometimes has automated captions too through a paid for plan. And then some video call options. So video calls are important for people to stay connected, especially during this time where it can be hard to see people in person if you're high risk or immunocompromised. It's useful for individuals who sign to convey information and contact emergency services. A lot of phones nowadays have automatic video calling, whether you're on an iPhone for FaceTime or you use an Android and you have Google Hangouts. There's other options like Facebook Video Messenger, Skype, BlueJeans, and all the telework softwares too. We can go to the next slide. Okay, so now I'm going to talk a little bit about some apps for touch-free shopping. Touch-free shopping is super useful for people who may not be able to go to the grocery store during this time. It may not, some of the apps that we're going to talk about may not be available in all areas. So just depending on where you are, it may be good to kind of check before you sign up for something. Some good ones are Instacart, Shipped, Walmart Plus, I believe. A lot of grocery stores, I know my Kroger, you can order online and pick up curbside. Chewy is for all pet needs. So I know a lot of friends, let's say you don't want to pick up a 30-pound bag of dog food, you can have it delivered right to your door. So those are just some options for essential item delivery. Food delivery, I am an avid user of these. And like I said, some of these may not be available in your location. So Uber Eats, GoPuff, DoorDash, Postmates, a lot of them have the option where you can actually have the delivery person drop them off in a safe place at your house, and it can be completely contactless, which is awesome. I know GoPuff does a lot of snacks and also anything that you can get at the pharmacy. So let's say you need some paper towels or medication, over-the-counter medication, you can order that on GoPuff.
Right. And so as Sierra mentioned, oftentimes the barriers are quite different for urban versus rural locations, especially when it comes to availability of some of those delivery services. Oftentimes, you can still call in. If you're in a rural location, you may be able to call in and have curbside pickup, but they may not be able to deliver. And again, those barriers, they vary widely. So it could be internet access that is the barrier, cell connection. I know if I go to South Georgia, there are vast swaths of the state where I have no cell reception. And then food access. We have a lot of food deserts in different places. We're here in Georgia, and there's a lot of them, but across the country, there are not always ready access to a grocery store, to a pharmacy, or to a place to get some of those essential goods. I know if you're maybe in Wyoming, you're measuring distance in terms of how many hours does it take to get to the next town. So that's an important thing to consider. Your proximity to your neighbors. If you are having an emergency or you do need some assistance, where's your closest neighbor and how are you going to get in touch with them? And then service outages can differ from urban to rural locations. Just recently in Georgia, we had a lot of windstorms that knocked out power and internet. My apartment, I live by a train station, and so my power came back very quickly. But people that were just, 10 miles away, they were looking at power outages for days, up to a week for some folks. And then that's just power. When you look at things like internet coming back, or if your water is interrupted, those outages can really extend out for extreme periods in more rural locations.
Those are such great points, Danny and Sierra, and thank you. The other thing that we continue to hear when it comes to touchless shopping, just building on what Danny has shared with us, and obviously what Sierra was talking about, is a lot of folks, when they go to the store, they do need to use, some of those apps like TapTapSee and, Seeing AI. And so ways to avoid having to touch everything, any way we can help. Lots of folks within the community have asked for these types of supports, and I'm just so glad. And so thanks for finding those.
So next we want to look at some of the hardware and software combinations that can help improve safety and independence. So first we want to talk about some of the built-in accessibility that exists out there. So many computers come with an array of built-in accessibility. It didn't always used to be this way. It is thanks to people advocating for access and companies really making a concerted effort to include people with disabilities in their consumer base. So right now, pretty much any mobile device and most modern computers have screen reading software built in. For Apple, it's called VoiceOver, and for Windows, it's called Narrator. And they work very similarly. They use a mixture of commands, gestures on your trackpad, as well as keyboard commands to navigate a computer non-visually. So a person with um, limited or no sight can access their computer, they can check email, browse the web, um, do all of the things that anybody else is able to do. Now, screen reading software isn't just for somebody with a visual disability. People with learning disabilities and others with print-related disabilities will also use a screen reader. Sometimes people need multiple forms of input, and that is one way of getting that. Also, you now have display accommodations that come built in to most operating systems. So you can do things like changing the contrast, making it a higher contrast. You can even do color filter options. So a color filter could be just basically a filter that goes over your display digitally. For me, I sometimes turn on a red filter because it helps create a contrast that is ideal for me to access printed things on my phone. You can also have filter options for different types of color blindness to make sure that a person is getting the full experience, they're getting the full information that's on the screen with those options. You also have solutions for zooming in on the screen, whether that's whole or partial screen magnification. So this can act kind of like a virtual magnifying glass, so that if you just want to move it around over certain parts of the screen, you can do that. For me personally, I do a whole screen magnification, which can make people motion sick if they're watching me navigate my computer, because everything is moving all the time. And I'm zooming in and out to get to different parts of the screen. And then you're also seeing more voice control options that are built in. So computers are having a lot more commands where you can tell it to open your mail application or close an application. You can even dictate messages. You know, that's very popular on mobile devices especially. But it does give you, again, more freedom if you can't hold a mouse, if you have fatigue. It's something where you can switch to using multiple modes of input and navigation, so that you do have those options. So you may use a trackball and then you get tired and then you're going to use your voice. And then finally, video calling capability. People often think of this, they don't often consider this an accessibility feature, but for people that do use signed languages, video calling is very important. It's also just a good way of keeping in touch with friends, family, and loved ones to give a little bit more of a personal connection. Next up, I do want to talk about some of the features for the Apple Watch specifically. This is a device that I use on a daily basis. Recently, they did add a hand washing timer. So it'll give you an audible, a tactile, and a visual alert for timing your hand washing. So once you turn on the water and start wetting your hands to get the soap, a timer will start and you'll feel it kind of tapping on your wrist. And if you have the sound on, you'll hear the timer counting down. And once you've hit 20 seconds of hand washing, you get a different tap on the wrist, and then you get a little thumbs up on the device so that you know you've washed for the right amount of time. The good thing about this is that it's automatic. You don't have to do anything. You don't have to actively start the timer. It's going to do it on its own. And it is pretty accurate. So this is really good maybe for someone with a developmental disability or an intellectual disability that need that extra reinforcement to know when they've washed for long enough. It does also have hard fall detection. This is one that I've inadvertently tried out a couple of times. So hard fall, if you do have a fall and it detects that, you have 60 seconds to respond on the screen that you're okay. If you don't respond within 60 seconds, it will automatically call emergency services, and it will send a text message with your location to your designated emergency contact. So this is good for people who may be prone to falling, or who just want to have a little more uh, safety when it comes to things like, we've seen lots of stories when it comes to people that are hiking that have fallen, and this feature has helped with contacting emergency services. It also has an SOS feature, so maybe if you're going down the street and you don't feel safe, you can hold the button down and it will call emergency services. You can also use Siri for a number of features, controlling your home, contacting emergency services. It's also good for hands-free usability. And you can get alerts from connected devices. So if you have a flood alert in your basement and the water starts rising, it'll give you a push notification. These alerts are important because for people that may be deafblind, getting those alerts to your watch will also send them to, if you have a connected Bluetooth braille display, that will also come up on there so that you can read what the alert is on your device. And there is an image here of the Apple Watch and a person washing their hands with the hand washing timer counting down. A feature that this is coming soon, it actually just came out just this week, is distance alerts. So this is something that is only for the iPhone 12 Pro models. So this uses what's called the LiDAR sensor, which is light detection and ranging. So it's kind of like sonar or radar, but with light. So this is going to be built in. It's part of the Magnifier app in your iOS. So with this, again, you get audible, visual, and tactile feedback to determine the distance that a person is from you. So if I am, maybe in the grocery store, I can set it at 6 feet, and this sensor will alert me if somebody is 6 feet away because you'll hear a tone. Now, if they get closer, if they're 6 feet and closing in on you, you'll hear a different tone and you will get a set of vibrations to let you know that something is moving towards you. And then you get a different tone if somebody is more than 6 feet away. Now, if you're looking at the screen, it's also going to give you an arrow pointing to the people and showing their distance from you. So a very cool feature, a very timely feature. But again, it's only for these iPhone 12 Pro models, the ones that have this LiDAR sensor in it. So it's a really cool feature. I'm glad that they made it a part of it. And you're going to see this sensor is going to be useful down the line as people are developing for these mobile devices. You're going to be able to get things eventually like interior navigation, uneven pavement alerts, and lots of different environmental feedback. So I'm excited to kind of see where this goes beyond just the distance alerts.
Alrighty, so the Epic ID. The Epic ID, as I mentioned before, is a wearable device that allows you to upload emergency information, such as your emergency contact information, your health and insurance information, if you have any allergies, anything that you would imagine can go on this thing, including pictures, phone numbers. It's a USB device. It's waterproof, completely adjustable, so you can cut the band to make it smaller. It is Mac and PC compatible, but basically its purpose is if someone were to either have a communication problem, or if they were injured to the point that they couldn't tell someone where their medical information is, a person could, or an EMT could plug this device into their computer and all of their medical information would pop up.
All right, and we mentioned earlier looking at low-tech solutions when it comes to having a backup. So we have 4 images here. In the upper left-hand corner is just a basic communication board. So this is two-sided. On the opposite side, you're going to have just the alphabet and some numbers. But on this one, it has some of those basic pronouns like I, some of the who, what, where, when, whys, and some different features. These are customizable. So you have some that are kind of standard, but then you can also mix it up and make your own communication boards that you can point to. Again, maybe if you're using a high-tech device and the battery is running low, you can switch to a communication board. In the upper right-hand corner, we have just an infographic. So these are useful. You can put these, you know, of course, in businesses, but also you can use these in your house. Maybe if you have a young one, or if you have somebody with an intellectual disability, somebody who just needs a little extra feedback or a little extra information. This is one for washing your hands. So it has all the different steps of washing your hands. And you'll notice it's, if you print it, it's large print. But you also have a graphic showing what's going on, as well as the word. So you have wet, get soap, scrub, rinse, and dry. So you're having those multiple forms of accessing the information from just an image to the words. It's not overwhelming, and it gives you just the information that you need to accomplish that task. Similar things can be put around in the kitchen or the living room or different parts of the home. Having a way to organize your medication. So this is a weekly pill organizer with morning, noon, night, and evening medications. So again, this is great. This is a way of, you could have one of these packed in case an emergency happens, and then you can grab that and go and have your medications ready. The lower right-hand corner, we have just a unicular, a little mini telescope, if you will. So this is good for if you're trying to see the name of a street, or to see something in the distance, or to find a friend. You can use that rather than your video magnifier, your head-based device, or whatever it is that you're using that may be electronic to do that. This is also, again, just a good thing to keep in your pocket because you really never know when you're going to need it if you do have a visual disability. Smart home solutions can also make a really big difference for someone's safety. So in the upper left-hand corner, again, we have 4 images on this screen. In the upper left-hand corner, you have smart speakers. So you have the HomePod, the Amazon Echo, and the Google Nest devices. So a lot of people have these and they love them. They use them for playing music and getting news, and also controlling their smart devices. To the right, we have a device from Fibro called the Flood Sensor. So this can be put under a sink, in your basement, wherever it may be. The neat thing about this device is if it detects a water level that's rising, it will send an alert to your phone. And if you have smart lights, it will also turn your lights blue so that you know you need to go check the flood sensor. Again, having those push notifications, that's going to help somebody who is blind or deafblind to access that information. The lower left-hand corner, we do have some smart lights. So these are good for, for color therapy, for being able to really control the intensity of the light in your space, as well as to connect to some of those devices. You can also have your smart lights attached to different alerts for if you're deaf or hard of hearing. It'll flash the light when the doorbell rings, or it'll give one set of alerts when somebody's at the front or the back door, so that a person who is deaf would know which door to go to. And then in the lower right-hand corner, we do have the OneLink first alert, which is a carbon monoxide and smoke alarm. So again, it will send a notification to your phone to let you know where the device is going off. It has a high frequency alert for people that may be hard of hearing. It also has a light on it for people that may have a hearing related disability. So these smart home solutions can really work in tandem with your devices to make the home, or sometimes even these are included in the offices as well, a little more accessible and a little more accommodating.
All right. Thank you, Danny and Sierra. I'm so glad you brought up the medication management and adherence. There's so many people that are coming that have gone through and are, recovering from COVID. And I was talking with somebody the other day that's just having a tough time managing all the medications. And so thanks again for putting all these pieces in. Very important as we're thinking about this through the lens of COVID. And as we're wrapping up, really mindfulness and relaxation, so very important. And so we'll move to the next slide. Actually, Sierra turned me on to Calm. And so thank you, Sierra. Back in April is when I first started looking at this. And I have kind of tracked it. I downloaded it back in April with 3.9 million other folks. They've had, they said, over 60 million downloads, which is significant. And this is, it's got a free version. There's also a version if you pay more or pay for it, but it does help with breathing exercises. There's absolutely something to our breathing, meditation, sleep, obviously. And it's got, either the web browser or the app. And so multiple ways to access that. We'll move to the next one, which is the Smiling Mind. And this one was really developed for, by psychologists and educators, and it gives a wide range for all ages. Sometimes when we're talking about some of these apps, they're developed either for a lot specific age group or what have you. But this one really does go across the lifespan. Once again, it's free. And it helps manage some of the disruptions that happen in routines, which we know that's happening a lot with COVID. And so being able to stay calm and navigate through it. So we'll move to the next slide. And I was just going to tell you about Buddhify, which is yet another really cool app that's out there. The thing that's a little different to this is you can actually set timers. You can connect it to, your watch or what have you. It can tell if you're starting to get stressed. And then it'll actually help you in real time with, okay, let's, relax and let's do some meditation, all of that. They're pretty sophisticated in some of those classes that they have. And a lot of the people that have used this, several folks have talked to me about that, along with all these other ones, accessible apps we want to recommend. This one has been a success for a lot of folks. We'll move to the next slide. Zen garden. I have a Zen garden, a real Zen garden. When I was in Japan, I was like, I love these Zen gardens. So I came back and put one in my own yard. And there's a virtual one also. And so this is more just to remember that there are some apps out there that can give you that tactile. This can have some haptic feedback, and you can get into that space of Zen, and it's free. We'll move to the next slide. And I'm going to turn this on over to Sierra, who's going to bring it home.
So Balance is a personal meditation coach app. Right now it is only available on iOS, but it is supposed to come to the Google Play Store soon. They have 10-day plans that basically teach you about meditation based on your sleep, your relaxation, your focus, your happiness. They have wind down activities for people who just need to take a breath. They also have sleep meditation. It's a really cool app. It is subscription based, so I believe you can pay either monthly or yearly. A super neat app, and they have different meditation plans for where you're at. So if you're someone who is a beginner, you can start with the beginning meditation steps, or if you're someone who's already advanced with it, then they're going to give you some longer meditation tools. Next slide, please. And then just white noise and relaxing sounds. There's a lot of apps that are available for this. On the right-hand side of this slide, I have a picture of a Dome sleep machine. I use one for sleep. It basically creates a baseline background sound to reduce distractions. You can do this also with smart speakers. I believe Pandora also has stations that are just white noise or tranquil sound. There is an app. I have the logo here to the right with the blue background and the white bars. That's actually just called white noise. Like I said, there are a variety of options out there available. Healthy Browsing is a Chrome extension that basically just reminds users to drink water, blink, and stretch. Often when we're working from home or on the computer all day, we forget to do some of those things. Maybe not blinking, but sitting up straight, drinking water, getting up and walking around. It's a very simple interface. I have a picture of it to the right here. It's kind of just these little toolbars, and you can set reminders based on the increments that you want. You can have it play a sound. It obviously is only available in Google Chrome, but the reminders are fully customizable.
All right. Thank you so much, Sierra. We do have some resources, and we'll move to the next slide. Definitely check out the great information that our CDC has available. You can go to their website. There's also the Partnership for Inclusive Disaster Strategies and FEMA with their information. So we encourage you to keep in touch and track them. We're curious if you have any questions for us. I've already started getting questions on my phone. So as I said, you can think about this, share this information and ask us questions later, A-OK. But if you have a question, you sure can ask us now. And this is just an image of our Tools for Life team. And just so you can get in touch with us and know that we're here definitely to help. We absolutely want to hear from you and want to hear, what else you think needs to be created. Some of those examples that Danny and Sierra gave that have been specifically developed because of COVID have come from out of need, and they've come out of the disability community. So if you have ideas and want to share them, let us know. And also, if you have apps or other assistive technology, share it with us, and we'll be happy to spread the word. We do want to hear from you, and so please do contact us. And thank you all so much for participating today. Danny, anything that you want to say as we wrap up? And Sierra?
No, I think I've talked enough.
You did great.
Thank you all for being here.
Thank you all. Any questions that anyone has?
None have come through the chat as of right now, Carolyn, but we can wait just a couple more minutes if you'd like to see if anyone types in.
No problem. And do you mind talking a little bit about the survey and that how we're going to be doing that, Tori?
Absolutely. So we do have a survey that we would love to get some feedback on to see your input on today's webinar, as well as anything in the future. I will add that link to our chat here in just a moment, and you are welcome to click on that and let us know what you liked, what you didn't like. We are always open to any kind of feedback that you may have for us so that we may improve our webinars and other information that we give out to everybody.
All right. Well, thank you. As I said, I'm getting questions and comments now. Thank you all so much for the positive feedback. Thank you, Danny. Thank you, Sierra. Thank you, Tori, and our Tools for Life team. And thank you so much, Cassandra. Thank you. Thank you. And also, Lorena, thank you so much. Y'all take care, everyone. Stay safe, and please let us know how we can help. Take care. Bye.